and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
You know, we can self-promote ourselves. Okay, today we're going to talk about the 5 big lies about back pain or backache. And these are common things that we hear, Brad, when we're working with patients.
Sure.
And it's misinformation.
Right.
Right. Yeah.
They're out there, and well, let's talk
Old
about
myths. So let's start off with number 1. Number 1 is that people think that when they hurt their back, moving will make their back worse. And
Right.
the truth is, you really want to get some movement going as long as it doesn't make the pain worse.
If it does, yeah, if it's irritating it, then you gotta. That's not the movement to do. But
Right.
you find movements that are
There
tolerable.
almost always is a movement you can do. Do you want to just do trunk rotations, Brad?
Sure.
Do you want to throw a pillow over here, Lonnie? You see right behind you? So, yeah, we want to make Brad comfortable. Always he's a big baby.
Yes,
about it.
yes.
He's always a big baby
Think,
about it.
yes.
So this is one most people can do, wouldn't you say, Brad?
You're right, right. If you're in the throes of some severe back pain, maybe not, but out of that acute stage, you're just going to lay and
Gentle trunk rotations,
Right.
very limited to start off with if it hurts, but eventually you want to get some movement in that spine, the blood flowing. So the last time I hurt my back, I could do these.
could you?
Yeah. The other one I could do is, which I'll do it,
I'm
Brad.
going to say one thing about this one.
All right.
You can do this, and if you find that only one direction it's pain-free and the other way it hurts, well, don't go the way it hurts. Just
That's right.
work the pain-free
Find
direction. The other direction will come with time.
Why don't you stand up once, Brad? I'm going to go ahead. The other one you can do is, what we start doing is extensions quite often.
Sure.
For a lot of people, it's just starting to just gently get some movement into extension here. And you might even just do the prop like
Right.
this up on your elbows. But again, just gently getting some movement, and eventually you're going to try to get way up in here.
Right.
So-
And I've just been I had 2 patients this week working with very exercise and coaching them on how to do that. Don't go way up if it hurts, but go in the pain-free range.
Right, that's number 1. Number 2, people believe I should avoid exercise, especially weight training. And the fact is, especially later on, no, you can go ahead and weight train, just don't do the things that could hurt your back.
Right.
Or make your back pain worse. Squats are a bad one, they
Right.
can,
Squats.
or deadlifts.
Right, or you're doing these lifts
Right.
that shouldn't be doing anyway.
But I mean, you
probably.
certainly can do curls, you can do tricep, you can do bench press.
Right.
I mean, those things are all fine for your back, and it's going to build up your core
Right.
somewhat and make your back better in the end.
You just need to use good judgment.
Right.
If it irritates it, if it gives you that back pain that you have, makes it worse,
Right.
back off.
Exactly. Number 3, the other big lie is a scan will show me what's wrong. So they want to do a X-ray or MRI, and in first case, only in 2% of the cases do they find anything on it. Did you know that?
Really?
I remember I had a radiology course. It was only 2%
Okay.
of the cases do they find anything. And the problem is often what they find isn't the problem. So on a healthy person, especially elderly person, quite often, if you're like 55, 65, you're going to have a bulging disc. Brad and I might have bulging discs,
Right.
and we don't know it. And so they do the X-ray, and you develop pain because of some other reason, muscular or joint, and they see the bulging disc, and they go, "There's your problem. You have a bulging disc."
Right.
And that's what. And so, I quite often, not that the tests aren't needed, because quite often they may be later on if
Right.
things aren't getting better. But initially, the scan's not going to show you anything, and it might even show you the wrong thing.
Right. We get a lot of comments coming back, and people will give us their feedback. Oh, this is a report from the scan.
Right.
And I try to narrow it down and say this is information, but for me, for the therapist, we oftentimes don't need it.
We go by symptoms.
Right.
Is there a movement we can do that helps decrease the symptoms?
Right. The old saying, do you treat the patient or treat the X-ray or the
Right.
MRI? We
Right.
treat the patient.
That's right. Aren't we something? Okay, number 4, I must have lifted something wrong. Everybody goes, I hurt my back, I must have lifted something wrong. And they may even done it while lifting, but actually the problem quite often, Brad, is sitting.
Right.
I mean, we're a sitting society now. We just did a video on sitting is the new smoking.
Right.
But when you're sitting, especially if you're kind of in a rounded out position like this, on couches or when you're working in the office,
Right.
that is putting a prolonged
Typing.
stress
yeah.
on the back all day long.
Right.
So then when you do try to lift something, the back's already weakened and in a bad position. So
Right.
sitting is more the problem more often with back pain than lifting.
Right.
A lot of the guys that are lifting stuff all the time or staying active, they don't have back pain. It's the ones that sit around all the time.
That can be very true.
All right, number 5. I shouldn't lie on my stomach with back pain. This is an old belief that because when you lie on your stomach, you're jamming the joints together. There's a few instances in which it's not good, like
Right.
spondylolisthesis, which Brad has,
Or stenosis.
But in most cases, it's actually good to lay on your stomach for back pain, and you might even do some of that bending up like what we were doing earlier, some of the press-ups.
Sure.
So those are the 5 big lies. I hope it helps you kind of readjust your thinking about back pain, because that can hold you up. I mean,
Right.
when last time I hurt my back, Brad, I was running the next day.
Really?
Yep, and because I felt like it didn't hurt when I ran, and I actually felt better.
Sure.
I still couldn't bend forward, but it was getting a lot of blood flow to the area and helping it heal, and
Right.
I healed quickly. So-
It's all back pain. The big thing is the no pain, no gain is out.
Right.
Is absolutely out. You need to find movement that makes it feel better or makes the pain.
That's the key.
Right.
That's the key statement of the video, Brad. Congratulations.
Excellent.
All right. Thanks
Sooner
for
or later,
watching.
the broken heart, Bob.
Oh.
Yeah. Some of our viewers are actually catching up on that. They're watching our videos to the end.
All right.
Yeah.
All right. We can fix just about anything, but we can't fix.
that broken heart.
All right. Do you want to do strong like bull too right away?
No. Okay.
Strong like bull.
Strong like bull.
All right.
Got to roll the R. Strong
Strong like bull. All right. Thanks.